Okay, so first off, we have Dr. Frank McMillan, who is the Director of Wellbeing Studies at Best Friends Animal Society, and the first one is case presentation 1.
Okay. Oh, shoot. I took off my... Hang on a sec. Okay. Hang on a sec. Okay. Sorry about the cough. Okay, so here's what we're going to do. Dr. Burke told me nothing about this. She said, just put together the presentation. And I said, what is it? And she goes, it's a mystery. And so we'll see how it goes. Okay, so what we're going to look at today, I'm going to build up to it. I don't have a lot of time, so again, I'll talk fast. That's Paladin, a dog that we had at our sanctuary. And the mystery here is the complexity of what's going on with him dealing with this issue right here. And that is the challenge of the overlap of psychological trauma with other psychological conditions. So I'm going to start here. I talked about this last hour or the hour before. And that is there's no clear line between learned fears, healthy learned fears that your body and mind normally do, and psychological trauma or pathological fears. Okay, that's problem number one, is that overlap. The other overlap that we deal with in animals as well as in people is the overlap between psychological trauma and other emotional disorders. Sometimes there are emotional disorders that make up a part of the psychological trauma. Like, for example, depression can be a part of PTSD in people. So the overlap is very hard to draw a distinction of. Now here's Susan. Susan is a dog that was part of our rescue of Hurricane Harvey. And this, I took this only about 10 days ago. She's still in need of a home. So if anybody wants a loving dog that needs a home, it's her. What happened with Susan is that she was displaced, of course, because of the storm, but in the process of now relocating, her owner died. And so she was hit with, of course, the double whammy, if not more than double, of the trauma of going through the storm and the disruption to her life that way, and then the loss of all social companionship that she had used for relief from this kind of stress. And so that's her with the typical look. I actually spent time, I took my naps midday laying on her bed next to her in contact with her, and that helped her along because she was having trouble and still is with humans, but she's showing a lot of improvement. The problem is that for her, we've got this overlap, which is, of course, the psychological trauma of the storm and the major life disruption, but then the loss of the human companion that can contribute with depression or, in some cases, anxiety. Okay, now here's the big thing that gets thrown into our work that isn't nearly as common in people, and that is an incomplete history that doesn't tell us about the socialization of the animals early in life. Now, that's a pretty obvious thing, and you guys can, you kind of know what the consequences are, but I want to just tell you that what we've all been taught in terms of a simple concept of you fear what you weren't socialized to isn't as simple as that, and that's why it even makes it more trouble when it overlaps psychological trauma. For example, I told you last hour, for those of you who are here, dogs that are extremely highly socialized, like the puppy mill dogs, actually came out with a higher level of fear towards other dogs than dogs that were normal pet dogs. And so highly socialized, being their whole life with other dogs, does not make them, therefore, perfect with other dogs. So it's not a simple, you fear what you weren't socialized to. The other thing is under socialization, the way we use it, they were poorly socialized, inadequately under socialized. That's all relative to their current living situation. So mentally healthy animals can be put under severe stress when they're forced to live in an environment that their brain development did not adapt to. So the classic example here is a feral cat. You take a feral cat who's non-socialized and is outside, put them in a household, and it can be terrifying. Now, the reason that's important is because the cat was mentally healthy. May not have been in the best living situation, but was mentally healthy. Then they're put in a house, and like the puppy mill dogs, where everything is completely foreign, that shock to the system can itself be traumatizing. So the fact that we're calling an animal under-socialized, again, is all relative to what we're sticking them into as far as their living arrangement. And is that new living arrangement that challenges them psychologically, is that itself emotionally traumatizing? So here's the overlap we deal with animals that don't have a complete history, and that is the learned fear, which is totally mentally healthy, a psychopathology in the psychological trauma, and then the mentally healthy with an asterisk because they can become mentally unhealthy if put into an environment that their brain did not develop and adapt to. So where do we put something like a shy dog? I mean, what category does the shy dog go into? It's hard to say because we can't always distinguish the two. And in fact, of those three things that overlap, a shy dog, it may be none of those. It may actually just be that the dog has a genetic and personality predisposition to shyness, and that's perfectly normal. It's just that some dogs are like that. I'm like that. I don't go to parties. Totally antisocial. Okay, so here's the three studies that we did. By the way, I forgot to mention, if you wanted the copies of any of the studies, just email me, and I'll email you the studies. Anyway, I put them up here. We're not going to go over them again, but all of them have problems of us knowing the early life of the animal. So inadequate or insufficient socialization weighs in with potential trauma, with normal fears, to create a dog, as I showed you on the profile, that are very fearful of people generally. Now, it's not exclusive to animals, fortunately. In humans, there's a problem that develops in young children that are very, very socially deprived, and this became well known when the Berlin Wall fell, and the Romanian orphanages and the Russian orphanages that had hundreds of children, infants, that had maybe one caregiver per 200 infants, very socially deprived. And when they were when they matured, a lot of them were adopted by couples that flew over from here, adopted them, brought them back. They had emotional problems at a much higher level than typical people because, again, early social deprivation. The reason I put it up here is there's a huge overlap for human psychiatrists, especially the child psychiatrists, when a child is emotionally deprived, of distinguishing the signs that are PTSD signs and social deprivation signs. So I just want to point out that there is the problem, not just in animals, that they do face that in children too. Okay, that was all done in one breath so I could get to Paladin here. How much time is Dr. Mark? Oh, okay. All right, so here's Paladin's story. Paladin in early life was a junkyard dog. Minimal to no contact with female humans. I don't even know any beyond that, meaning I don't know what the true socialization of 3 to 12 weeks was. All I know from our history that we could get was that was his early life, a junkyard dog, and we did know that he had less contact with women. The junkyard changed ownership several times while Paladin was there. So he went through a number of owners, if you can call them that. The last time the junkyard was sold, a man working there took Paladin home. Paladin was kept as primarily as a yard dog, and for a while he seemed social and playful. Okay, don't have the details on what kind of social interactions or playfulness. That's just the note we got from his history. But here's the problem. Suddenly and viciously attacked the owner's girlfriend. And then here's the bigger problem. The owner immediately put him in a cage, and fearing what he would do if he escaped, He and his friend shot Paladin multiple times in the head. So this is how he came to us, with 5 bullets in his head. Now the problem, the behavior problem, seriously? Okay, the behavior problems that we had with Paladin, and by the way, he passed away. He developed degenerative myelopathy that just progressed too far. It's nothing ugly that did it. He just passed away from that a short time ago. Extreme fear of humans with human-directed aggression, and the problem's worse with women. So this is what I already showed you. The common diagnostic complex that we face for dogs with severe adversity with an unclear history is that overlap. Here is Paladin. You add in traumatic brain injury, which is seen a lot now in the soldiers coming back from Iraq and Afghanistan. And it's very difficult to distinguish the signs of TBI from the signs of PTSD. And so they're facing a problem similar that we faced in Paladin. So we don't have a lot of time, but I'm going to stop at this slide and ask you guys for your input on your thoughts, what you would do, how would you approach this. This is Paladin in your care. What do you think? Any ideas? It's not easy. Okay. First of all, it's impossible, flat out, to distinguish exactly what's going on. But then we have to develop treatment approaches. Back in the way corner.
I would let Paladin guide what I did.
Starting with.
Starting with finding out how much contact he would accept from first males, and then males with females, and then, try not to stress him in any way, and then just see if he absolutely positively refused. That's what you got.
Okay. Yeah, and what you're describing, by the way, is a very broad approach to treatment, which is, without distinguishing all those things, you're approaching the case in a very similar way. And then there's nothing wrong with that. It's just, unfortunately, where we're stuck right now, that we don't have the ability necessarily to distinguish. Dr. Merck's going to pull, but she's going to give me the hook in a second here. So let me just real briefly point out that if we look at this problem we face, whether it's the 3 different interactions of complexity or the 4 with traumatic brain injury, why do we care that we distinguish these? Well, we only care if there's differences in either treatment or prognosis, and that's what we faced with Paladin here. If we look at treatment, this is the approach that she just mentioned in the back, and that is that no matter what's going on, we put into effect standard fear treatments. Okay, what are those? Those are things like desensitization, counter-conditioning, and easing into things like that, habituation type thing mixed in there too. So standard fear treatments are the general approach that we have to use at this point in time. But there are differences. In people, for example, certain drugs are ineffective in the treatment of PTSD. Okay, benzodiazepine drugs, ineffective. So these are important factors that are now coming out to where they're going to guide us, and that's why it does make a difference for us to try to distinguish these the best we can. The other thing is really fascinating, and that is potential new treatments. There's 2 papers that were just published on PTSD in people that are finding an immune component. There are inflammatory proteins that reflect an immune disorder, and it may just be that immune therapy may actually be part of a treatment plan for PTSD, which is incredible. Who would have thought of that kind of a thing until somebody investigated it? So distinguishing these things may become extremely valuable. What about prognosis? Well, there's differences here too. The socialization is literally how neural connections get laid down during development, and so they are going to have some limitations in terms of treating that kind of a thing. There's a good prognosis for a lot of animals that weren't well socialized to people, but there's limitations and the brain can only go so far. Why is that important? Because if you reach that point and you keep pushing an animal, you're just going to torment them from that point on. Their brain does not have the capacity to do that. So it'd be nice if you knew that, because then you could know and guide yourself a little bit better and not be disappointed by by the inability to reach an endpoint that you might think is a normal dog. The other thing about prognosis is the potential unknown triggers in the right bottom corner there, meaning that for inadequate socialization or learned fears, things become pretty clear exactly what's triggering the problems in fear-based things. But not so always in post-traumatic stress, because you don't know everything that that brain of that particular animal connected to be fearful of. So triggers might be a bit of a surprise later. That's not to say don't adopt these dogs or cats or whatever. It's just to say that sometimes there's unknowns that you do have to face as the reality. So there may be in that particular situation an importance for us to best distinguish these and not just lump them all into the same old plan of action of treating them all the same and expecting similar results from all of them. So here's Pal, and we did exactly what was mentioned in the back. We did our best in terms of building trust with the people that he worked with, and Carissa, our caregiver there, was just wonderful. She was his closest caregiver, and even though she was a woman, Pal became bonded to her. And Carissa was the one that introduced him slowly to other people, very, very slowly, like over weeks' time. And Pal started to open up and become better with other people. He never became normal. And in fact, he was always off our volunteer list. He's got a red collar, which for us means you can't trust them with people that don't know what they're doing with animals. Green collar means anybody can walk them or something. So Paladin never got out of that status, but it's not a put down. It's just the fact that considering his brain and the psychological changes, the being abused, the being shot, the being brain trauma itself, gave him obviously a big hole to dig himself out of. And so we got a lot of results, and it was really sad when he passed away. So I'm out of time, right? Okay.